Hi guys, Dr. Kendra Pope here, Integrated Veterinary Oncologist. Welcome back to my channel. Last week we talked about the cancer incidence in dogs and how it's 5 times higher than it is in people. This week I want to talk with you about the genetic causes of cancer. Did you know that only 5 to 10% of cancers are actually caused by genetic reasons? Purely bad luck. So a lot of times my clients will say that they were told that their pet's cancer was just bad luck, that there was nothing that they could do about it. Have you ever been told that or heard that? Has a family member ever been told the same thing? The reality of the situation is that only 5 to 10% of the time, it's just bad luck. That the animal was born with genes, that there was nothing that they could do about it, and it caused cancer. That means 90 to 95% of the time, actually, the cause of cancer is something that is preventable and modifiable with lifestyle factors. So the difference is in something called genetics and epigenetics, which we'll talk about a little bit right now. And what epigenetics means is literally just above the genes. What are those factors around the genes that affects that expression of those genes? So to give you a little bit more information, when we're talking specifically about cancer, there's 3 genes that are important. One is called a proto-oncogene, or tumor driver. We think about that as like the gas pedal in the car. There's also tumor suppressors, which we think about like the brake of the car. And then we also have repair genes, which do exactly what it sounds like they do. They fix anything that's broken and clean up the mess. Now, why is this important to cancer risk, and how is this something that can be modifiable with lifestyle factors? Well, if we have these tumor drivers that promote cancer, if we can turn them off, then we can prevent that change of the cell to a cancer cell. So situations where we would want to be able to change this or modify this or identify this is if there were genetics present in an animal that they had these genes that could turn on cancer cells. If there were things that we could do to tell that gene to calm down, to go to sleep, to turn off like a light switch, then we could theoretically prevent that animal from developing cancer. Now, the same is true in the opposite situation, where we have these genes that turn off cancer cells. Now, if they were turned on, either because of lots of stress in the environment, or lots of inflammation, or a poor immune system, or poor GI health, or any other chronic disease that was contributing to weakness in the system, and those genes were turning on, trying to turn them off could help us to get back into a balanced state. So the thing about these on-off gas, brake, and repair genes is that they're dynamic. They can be turned on and off. And that the optimal state to prevent cancer is when the whole system is healthy, when we eliminate inflammation, when we have strong immune system function, when we have low toxin burden and toxin avoidance. And so doing a lot to help and support the environment, not just the tumor environment, but the whole environment of the patient, can help to keep these genes in the optimal states to prevent cancer. Now, we don't have as much data in animals as we do in people around this, but we would assume, like we normally do, that a lot of these factors are very similar because animals develop the same types of cancers with the same biological behaviors as people, and we live in the same environments exposed to the same things. What we know on the human side is that there's research that shows as high as 60 to 70% of cancer deaths can actually be mitigated and modified and prevented by lifestyle factors. Now, what are some of those factors that we know can do this? Well, some things that our animals are not engaging in. Cigarette smoking, although they do experience second and third hand smoke, so that is important to them. Alcohol consumption, and UV light exposure. Those are some of the most important ones we know that can decrease rates of cancer and cancer deaths in people. But the other ones that we are consistently finding are making huge differences in cancer rates are related to diet and the amount of processed food consumed, to activity level, as well as obesity and your body condition, your lean body mass, toxin avoidance, and toxin burden in your environment. And then over and over again is blood sugar balance. Basically making sure that our blood sugar levels are nice and low. We're not having these high spikes from the food that we're eating. So what are the things that we can do in our pet's environment, in their routine, and their lifestyle to be able to mitigate some of these things? Stay tuned because I'm going to give you more information about all the specifics.